Hi, I'm a nursing student from Houston Baptist University, and I'm here to talk to you about breast cancer. There are some important facts that you need to know about breast cancer. It is the second leading cause of cancer death in women, just after lung cancer. Over 182,000 new cases of breast cancer are diagnosed yearly. 99% of these cases are in women. Increased age of a person increases the risk of developing breast cancer, but it can also be diagnosed amongst the younger population. One's race or ethnicity also affects their risk of developing breast cancer. Caucasians have the highest risk, followed by African Americans, Hispanics, Asians, and Native Americans. There is also a genetic link. 5 to 10% of all women diagnosed with breast cancer have a mutation in the BRCA1 or BRCA2 gene. Breast cancer is more common in industrialized nations such as North America and Northern Europe.
Breast cancer is a disease in which abnormal cancerous cells grow in the breast tissue and multiply rapidly. Breast cancer most often occurs in women but can also occur in men. The cancerous cells can originate in the milk ducts, lobules, or fatty tissues. If left untreated, the cancerous cells in the breast can metastasize or spread to other areas of the body. This diagram shows locations that malignant cells most often originate. While sometimes there are no evident signs of early breast cancer, some important signs or symptoms to be aware of include a palpable lump in the breast or underarm, or possibly thickening of tissue that feels different from the surrounding tissue, abnormal discharge from the nipple such as blood or clear fluid, a change in size or shape of the breast, or changes in the skin and areola such as scaling, changes in the skin covering the breast such as dimpling, or redness or pitting of the skin over the breast. Though there is no specific cause of breast cancer, there are numerous risk factors for developing breast cancer in your lifetime. These include being female, increased age because it most commonly occurs in women over the age of 55, having a first-degree relative who has had breast cancer, having a personal history of breast cancer because there's a high chance of recurrence, if you've ever had radiation to the chest for treatment of another type of cancer, your race or ethnicity, because Caucasian females have a higher likelihood of developing breast cancer, being overweight or obese, having your first child after the age of 30 or never having a full-term pregnancy, your breastfeeding history, because breastfeeding actually decreases your chances of developing this type of cancer, having never breastfed would therefore increase your risk. And risk is also increased in women who experience menopause after the age of 55, or who began menstruation before the age of 12. Finally, personal habits such as lack of exercise, a history of smoking and alcohol abuse can also increase your chances of breast cancer.
So now I'll be talking to you about ways to prevent breast cancer. Limit alcohol intake. The more alcohol you drink, the greater your risk for developing breast cancer. If you choose to drink alcohol, including beer, wine, or liquor, limit yourself to no more than 1 drink a day. Avoid smoking. Studies have shown that there is a link between smoking and breast cancer risk. Control your body weight. Being overweight or obese increases the risk of breast cancer. This is especially true if obesity occurs later in life, particularly after menopause. Be physically active. Physical activity can help maintain a healthy body weight, which in turn helps prevent breast cancer. For most healthy adults, the Department of Health and Human Services recommends at least 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity, plus strength training for at least twice a week. Breastfeeding may play a role in breast cancer prevention. The longer you breastfeed, the greater the protective effect. And if you are on hormone therapy, it's recommended to limit your dose and duration. Combination hormone therapy for more than 3 to 5 years increases the risk of breast cancer. You may be able to manage your symptoms with non-hormonal therapies such as physical activity. If you decide that the benefits of short-term hormone therapy outweighs the risk, use the lowest dose that works for you. Avoid exposure to radiation and environmental pollution. Medical imaging methods such as computerized tomography uses high doses of radiation which have been linked with breast cancer risk. While more studies are needed, some research suggests a link between breast cancer and exposure to the chemicals found in some workplaces, gasoline fumes, and vehicle exhaust. Some ways to detect breast cancer include a mammogram, clinical breast exam, and a breast self-exam. A mammogram is an x-ray of the breast. Mammograms are the best method to detect breast cancer early when it is easier to treat and before it is big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. If you are of ages 50 to 74 years, be sure to have a screening mammogram twice every 2 years. If you are of ages 40 to 49 years, talk to your doctor about when and how often you should have a screening mammogram. A clinical breast exam is an examination done by your doctor or a nurse, who uses their hands to feel for lumps or other changes. A breast self-exam is when you check your own breast for lumps, changes in size or shape of the breast, or any other changes in the breast or underarm. So now I'll be showing you how to perform a self-breast exam. Using the pads of your fingers, press firmly on your breast, checking the entire breast and armpit area. And there are 3 patterns to do this. You've got the circular pattern. You start at your nipple area and you circle around it, moving outward at the same time. Then you've got your up and down pattern. You'll start at the top of the breast and move your way downwards until you have reached the bottom, and then go back up, then go back down, and so forth. And last, you've got the wedge pattern, where you start outward, then palpate towards the nipple, then repeat this motion in wedge sections, moving around the breast. You can also inspect your breast lying down by placing a pillow under your shoulder of the breast you will be inspecting and doing the same 3 patterns that was taught earlier. Self-breast examinations are important to the university community because breast cancer is often a very damaging or fatal disease because it is diagnosed later in life. This late detection is because of the lack of screening. So it is very important that even young women get mammograms and perform self-breast exams, watching for any unusual lumps that may indicate breast cancer. So some breast cancers are not found by mammograms. Because the test was not done, or because even under ideal conditions, mammograms do not find every breast cancer. So here are some signs and symptoms you yourself can watch out for that might suspect breast cancer. The most common symptom of breast cancer is a new lump or mass. If you find a new lump or mass, it is important to tell your doctor right away. Swelling of all or part of a breast, even if no distinct lump is felt. Skin irritation or dimpling. Breast or nipple pain. Nipple retraction, which when your nipple is turning inward. Redness, scaliness, or thickening of the nipple or breast skin. A nipple discharge other than breast milk. Swollen lymph nodes under the arm or around the collarbone. So here are some treatment methods for breast cancer. You've got breast cancer surgery, which includes a lumpectomy, a mastectomy, sentinel node biopsy, and axillary lymph node dissection if the cancer has spread to your lymph nodes in your armpit. Radiation therapy, which uses high-powered beams of energy such as X-ray to kill cancer cells. Chemotherapy, which uses drugs to destroy the cancer cells. Hormone blocking therapy, which is often used to treat breast cancers that are sensitive to hormones. Targeted drugs, which attack specific abnormalities within cancer cells. These include Herceptin, Tykerb, and Avastin. And you could also become part of clinical trials. They test new and promising agents in the treatment of cancer. These include new combination of existing drugs, bone-building drugs to prevent breast cancer recurrence, and using higher doses of radiation over a shorter period of time or a smaller portion of the breast. Management of breast cancer when you are diagnosed includes alternative medicine for fatigue, which include gentle exercise, managing stress and relaxation strategies, learn what you need to know about your breast cancer, talk with other breast cancer survivors, keep friends and family close, maintain intimacy with your partner, and most importantly, take care of yourself.
In rehabilitation, the main goal is to improve physical well-being, build strength, boost self-image, and promote a good mood and attitude. The services of rehabilitation include physical therapy after a mastectomy. Restoring arm function on the affected side is achieved through arm, shoulder, and hand exercises. Psychological care through peer support groups, such as the Reach to Recovery program, is very important because women coping with breast cancer need chances to express their authentic feelings therapeutically. Breast cancer reconstructive surgery can be performed to achieve symmetry and to restore or preserve body image.
Breast cancer affects multiple dimensions of health. Patients undergoing breast cancer treatment are commonly afflicted with the following symptoms, which include nausea and vomiting, fatigue, a phenomenon known as chemobrain, which is when problems with memory, attention, and concentration begin to arise, lymphedema, bone loss, peripheral neuropathy, infection, and pain. These symptoms create a lower quality of life for patients with breast cancer. Breast cancer also affects other health characteristics. 2/3 of all women diagnosed with breast cancer tend to gain weight. For this reason, it is increasingly important to maintain an active lifestyle and have a balanced and nutritious diet. Body image is also very commonly an issue amongst this population because many breast cancer patients are left with temporary or permanent visible reminders of their experience, such as scars, skin changes due to treatment, hair loss, and lymphedema. These physical changes contribute to a woman's overall self-esteem and body image issues. The patients diagnosed with breast cancer are also commonly diagnosed with depression, which can manifest as a loss of interest in sex or finding sex less pleasurable. Anxiety is also common amongst this population because patients with breast cancer may have the fear of recurring breast cancer, body image and acceptance issues, or economic struggles related to their treatment. Some of the therapies that are used to treat cancer may also cause pregnancy and infertility issues by causing an early onset of menopause or temporary or permanent infertility. There are a variety of support groups for breast cancer patients which ultimately help the patient cope with their diagnosis. Support groups are groups of people with familiar life situations which meet regularly to share their concerns. Amongst others, there are 3 main types of support that members can receive at support groups, which include informational support, emotional support, and practical support. Informational support provides information about the diagnosis itself and the treatment options that are available, which help the patient become informed and make the appropriate decisions regarding their health care. Emotional support enables group members to share their experiences and empower each other. Practical support occurs as members themselves help each other with specific tasks, such as offering rides to doctor's appointments, helping each other with cooking, cleaning, or other chores, and even providing an extra set of ears during doctor's visits. There are several benefits of joining our support group, including reduced anxiety and psychological stress, reduced depression and feelings of pain, improved mood and self-image, improved ability to cope, and improved feelings of control. Overall, support groups help empower the patient and allow for a better support system as the patient goes through this life challenge. There are many support groups in our Houston area. Some of the Houston area support groups are the UTMB Health Breast Cancer Support Group, the Kelsey Siebold Support Group, the Sisters Network African American Breast Cancer Survivorship Organization, and the Northwest Medical Center Support Group. Now that you're informed about breast cancer, get out there and make a difference.